The decision between laser eye surgery and lens replacement surgery, or even other procedures like phakic intraocular lenses, depends on a full consultation. The reason for this is there are many factors that you have to take into account. The basic one is the prescription, but one has to look at the corneal thickness, one has to look at your age, one has to look at whether there's any evidence of any early cataract. So the tendency would be to do laser eye surgery in somebody who's below 45 and does not need reading glasses. But they also need to have a prescription that is amenable to laser eye surgery. That is, it cannot be too high. And also the corneal thickness and the corneal shape has to be appropriate for laser eye surgery. For most other prescriptions, we can do a refractive lens exchange, and more on occasion we do phakic intraocular lenses on young patients who have higher prescriptions than can be corrected with laser eye surgery. So a typical clear lens extraction patient will be over 45 with a moderate prescription, which can be either short-sighted or long-sighted, but someone who wants a combination of both distance vision and near vision with as little dependence on glasses as possible.